I'm
Yeah.
used to it. My body likes it. So,
Yeah, and so I'll mention what I found was what kind of had me looking is you can never mix DMSO with any sort of pharmaceutical. Now, for me, I use ivermectin a lot within treatments for parasites. With something like, say, multiple sclerosis, we are now understanding that as parasites of the brain and spinal cord. Well, if you want DMSO to penetrate to these areas, you're going to want to pair it with some ivermectin. And so I did extensive tests on myself first, and I never had one contraindication. And then I did it testing with, people that are in my close circle and worked out from there. And now, I recommend it to anyone that's dealing with, maybe a spike protein, maybe too many jabs, maybe has MS, or maybe you're brittle with parasites. And not one person has ever come back to me with any sort of contraindication. Now, don't be using DMSO if you are, if you have, taking a bunch of opiates every day. Obviously, that's not something we should be doing. But I think there needs to be further study and examination, especially with things like ivermectin and fenbenzolone. So there was this one line in the research that he did when he was telling a story. And he said that Big Pharma came to him, I don't know the exact rep, and told him, quote unquote, this is a quote, DMSO is the major drug of the century, and we know it, but we cannot patent it, so therefore we will destroy it.
really,
Yeah.
just like everything else.
Just like everything else, and no qualms about saying it. So I thought that was incredibly interesting. And obviously back in the 60s, they probably didn't understand what the internet was going to do and that these things would be actually recorded and spread globally. But that's really interesting. And that gives you guys a little bit of a edge or eye into what Big Pharma is. And they're using it for what they want, but they're demonizing it for a lot of other things.
So why are people so afraid of putting natural substances in something that's natural?
Right.
And it's so easy.
The fear people have, they're using pharmaceutical. Sean, you're on our screen. Are you aware of that?